Health reports indicate alarming levels of childhood obesity in America. About 1 in 6 children has obesity. Although not all of us are parents, it's safe to say that when we were all children at one time. How much of our eating was developed while we were kids? What could have made a difference? Did you have access to healthy foods? Today, I'm going to discuss childhood obesity, a serious problem in the United States. What are some of the causes of childhood obesity? How do societal and community factors matter, and how does it affect access to healthcare? How can we ensure that there's access to healthy food options, and how can we prevent childhood obesity from continuing to be an issue? So what are some of the causes of childhood obesity? Genetics is one of the biggest factors examined as a cause of obesity. A study found on the NCBI 2017 website shows that BMI is 25 to 40% heritable. However, this genetic susceptibility often needs to be coupled with contributing environmental and behavioral factors in order to affect weight. The genetic factors account for less than 5% of childhood obesity cases. So this means that while genetics play a small role in obesity, it's not the cause for a dramatic increase in childhood obesity. Assessments of different factors behind poor diet offers many insights into parental factors that may impact obesity in children. Children learn by following their parents' and peers' examples and preferences, and these may impact obesity in children. There needs to be availability and continued access to healthy foods. This is key for children to develop preferences. Kids' mealtime structure is important as well, as it's been shown that families who eat together consume more healthy foods. Eating or watching TV is associated with higher fat intake. How a parent decides to feed their child is significant. An overly strong restriction of junk food is associated with an increased desire for unhealthy foods and higher weight. But giving a child a choice between several healthy options is associated with better eating choices. Environmental factors also play a role. Sociocultural factors, family factors, and psychological factors all play a significant role in childhood obesity. While too much television viewing and playing of video games or other electronic devices has contributed to more inactive lifestyles, other environmental factors have reduced the opportunities for physical activity. Our society tends to use food as a reward and as part of socializing. These uses of food can encourage the development of unhealthy relationships with food. This increases the risk of developing obesity. Family factors have also been associated with the increase of cases of obesity. The types of food available in the house and food preferences of family members can influence foods that children eat. In addition, family meal times can influence the type of food that the children eat and the amount eaten. Being overweight can cause psychological factors such as depression, anxiety, self-esteem, or body dissatisfaction, eating symptoms, or emotional issues. So how do societal and community factors matter, and does this affect access to healthcare? Childhood obesity causes significant healthcare costs. As these costs increase with continued obesity into adolescence and adulthood. For example, a child with obesity will have more ER visits, higher prescription drug costs, and attend more specialist visits than children at a normal weight. Children and adolescents living in households where the head of house has a college degree are less likely to be obese compared to those living in households where the head of household has a smaller education. Low-income children and adolescents are more likely to be obese than their higher income peers. According to the 2015 CDC website, between 1988 and 1994 and 2005 through 2008, the prevalence of obesity increased in children at all income levels and education, except for among girls in households where the head of household had at least a college degree. Other studies have also reported that lower income communities have reduced access to supermarkets and places to exercise, but that these same communities have numerous convenience stores and fast food chains, which taken together promote poor nutrition, and little to no physical activity. They also have, sometimes they don't have transportation to healthcare or have health insurance, although Medicare or Medi-Cal is definitely an option. Children in lower income communities reported substantially less physical activity, more poor nutrition, food intake like fried foods or sugary beverages, and more time watching TV or playing video games. So what can Kern County do to help prevent childhood obesity from continuing to be an issue? Kern would do really well to have as many free services teaching children or parents and educators about healthy eating habits. In recent years, many public health officials and community leaders, have recognized the need for community involvement in preventing disease and promoting healthy lifestyles. The NCBI website states that it has found that Girl Scouts who participated in troop nutrition classes, including tasting sessions and materials sent home, exhibited increased levels of fruit and vegetable consumption. Schools could provide cooking courses or teachings on healthier food and what they're eating, the importance of what they eat, and possibly food budgeting. Encouraging outdoor activities within a community to get children active and away from video games or TVs could also play a role in healthy behaviors. There's many things that we could do. I know that my neighborhood has activities for the kids to get out and ride their bikes and have water gun fights, and it's been really good at getting the kids outdoors and involved and having a good time. So today I talked about discussing childhood obesity. It's a serious problem in the United States. There are many things that play into childhood obesity, some being more critical than others. If parents apply a healthier lifestyle at home, many obesity problems may be avoided. What children learn at home about eating healthy, exercising, and making good nutritional choices will eventually spill over into other aspects of their lives. This will have the biggest influence on the choices that kids make when selecting foods to eat at school and fast food restaurants and choosing to be more active. Focusing on these causes may over time decrease childhood obesity and hopefully lead to a healthier society altogether. Childhood obesity can profoundly affect a child's physical health, social, emotional well-being, and their self-esteem. It can also be associated with poor school performance and lower quality of life experienced by the child. It's important that we make changes to help kids live a healthier and better life. Thank you.